Hi, my name is Emily Lefebvre, and I will be talking about the influenza vaccine in healthcare. To start off, what is the flu? The flu is many different strains of a virus, and it'll get you feeling sick and yucky. There are many different symptoms that you may engage in, which could be a fever, headache, body aches, chills, vomiting, diarrhea, and many more to come. So, how would you prevent the flu? To prevent the flu, you would eat your fruits and veggies, obviously, to build the immune system, but you could also get the flu vaccine, also known as the flu shot. This covers a certain amount of strains for that particular year. Not all strains are covered, which means that you are not 100% covered in each category of the flu. You are still able to get flu C if you have received the flu shot and it only contains A, B, and D. So benefits of the flu shot may include covering up to 3 or 4 strands of the flu, which is the most popular that get passed around from person to person of that season. Some people may end up with strand C, and some may end up with strand E that may have shown up 4 years ago. Each year is different because every shot has a different amount of strands of the previous year's highest flu. The flu is constantly mutating, and all the different effectiveness of the flu shot is all different. The shot has many different effects on people, young or old, good or weak immune systems. All people have different reactions that may or may not benefit them. In 2004 and 2005 season of the flu shot was only 10% effective, and then again was only 19% effective in 2014 and 2015 flu season. According to CDC, the average rate of effectiveness is 40% over these 14 years, from 2004 to 2018. In healthcare, when you do not receive a flu shot, you must wear a procedure mask in order to protect yourself from contaminating others. I am a CNA, and I personally would rather not wear a mask because you are not able to read my lips, and to elderly people, sometimes they have to go off of reading lips. You also sound a little muffled to them because of the mask, or you are intimidating them because they can't see your face other than your eyes. You may seem more like a host and can pass off the flu to the residents, but they are the ones with the weak immune systems, and the stronger immune system will obviously fight it off, which are the younger generations. The elderly people have a high chance of getting the flu from an outside person, but their family members are also able to give it to them. They do not have to wear a mask when they visit, but the caretakers do. It is a right to express just like any other. If you do not want to get the shot, you shouldn't have to. You should not be forced to get the flu shot because of a job. The effectiveness is not as high and is different for every person. Receiving the flu shot is not required to enter any school systems like any other vaccines. But when working in a nursing home, hospital, rehab center, or assisted living facility, you are required to wear a mask to prevent spreading the flu if you did not receive the flu shot, which is not fair because it is a right to refuse something that you do not believe in, according to our First Amendment. Overall, the influenza is able to hospitalize people, but it also may just give you a small cough. And like I said before, all people can get all different strands, whether they get the flu shot or not. Your body builds up immunity to the strands that you already have fought off, and there are good benefits and sometimes there's disadvantages to everything in the world. But you just have to remember that the flu shot is only as effective as the strands that were high last year. Thank you.